You see my presentation, you can hear me just fine?
You look and sound good.
Okay, great. So I'm going to talk about two recent transit studies that we have conducted. One was in Minnesota and the other in North Dakota. And so in the Minnesota study, we did an analysis of the benefits of rural and small urban transit services, and we did a few case studies within the state. So I'll talk about those case studies and the results of those. And then in the North Dakota study, there were a number of different objectives for that study. So I'm just going to give kind of a quick summary of what we did. And including that, we did looked at the transit service levels in the state and where there's gaps in services, what the service needs and funding needs are across the state. We also looked at the demographics of transit riders, including in the rural areas, and also estimated the benefits of transit in North Dakota. So these are the two studies that we did. The Minnesota one, this is conducted for the Minnesota DOT. It was published last April. And this one, you can find this, there's a link to it on our website. The North Dakota one, this is for the North Dakota DOT, and it was completed more recently. We don't have it on our website yet, but you will be able to find it there in the future. So I'll talk about the Minnesota study first. And the rationale for this study was that we know there are many benefits of rural transit, but those benefits are often unmeasured or unidentified. And we really need information, some hard data on what exactly those benefits are to be able to inform investment decisions, especially because we know rural transit agencies are competing against a number of other interests for scarce funding dollars. So the objective of this was to identify and measure those benefits and try to put some actual numbers on what those are. So first, and then the scope of the study was for greater Minnesota, so all of the rural and urban systems in Minnesota, across Minnesota, outside of the Twin Cities metro area. So the first thing that we did was to identify what all those potential benefits and impacts of providing transit is in these communities. And so we identified and categorized them using this transit benefits assessment tree. Identified two main types, societal benefits, which we estimated using a cost-benefit analysis, and economic impacts, which are any impacts to the economy, which we analyze using an economic impact analysis. Within the societal benefits, there's two main types of benefits. There's mobility benefits and efficiency benefits. And the mobility benefits are the benefits of providing trips to people who otherwise would not have made those trips. So additional work trips, healthcare trips, shopping trips, other types of trips that just would not have been made. And the efficiency benefits are the benefits of making trips by transit instead of driving yourself or getting a ride from someone or walking or making that trip some other way. So within mobility benefits, there's many different types of benefits. There's direct benefits to the users because they benefit from making additional trips that they would not have made. There's access to healthcare benefits, improved access to healthcare results, and it can result in reduced healthcare costs to the user, as well as improved quality of life. Transit could allow people to age in place, to continue living where they're living and not have to move somewhere else that has better access. And there's also a lot of intangible benefits. It just can improve social connectedness or quality of life. There's potential public cost savings from transit because transit improves access to employment. Without transit, many transit users use transit to get to work. And if that service did not exist, they might not be able to get to work. They might not be able to maintain a job, and therefore they might be collecting public assistance. So by providing that improved access to work, transit may be able to reduce spending on those public assistance programs. Transit also can improve productivity in local economies. Local businesses benefit by having increased access to labor, and improved access to education and job training can also improve the education of the workforce. Transit also promotes equity by providing opportunities to people who are physically or economically or socially disadvantaged and are not well served by other transportation options. And transit also just provides an option value. It's another option that's available to you, even if you don't plan to use it. It's there in case you ever need it, in case your car breaks down or you have surgery and you just can't drive. It's there if you ever need it. The efficiency benefits include vehicle operating cost savings. Taking transit could be cheaper. Chauffeuring cost savings. So many people who take transit, maybe they can't drive themselves, and they would have to rely on someone else to provide a ride for them. So so they would incur, whoever provides the ride would incur vehicle operating costs, and they would have to take the time to provide that trip. So there's potential time savings. And there's other impacts or benefits from taking transit: travel time, safety, environmental congestion, physical activity. These are probably not as important in rural areas, but we included all of them in our analysis to be complete. And then there's also the economic impacts, any changes to the local economy as a result of the investment in the transit service. So there's a few different types of economic impacts we looked at. There's impacts from transit spending. So transit agencies directly employ people. They directly create jobs, drivers, dispatchers, managers, etc. And other businesses also benefit by providing services or inputs to the transit agency. And those people who work for the transit agency or those other businesses, they spend money within the local economy, and that results in additional induced economic effects. So we analyzed those direct, indirect, and induced economic activity that results from this. And we also looked at impacts from improved access to shopping. Additional shopping trips are made in local businesses might be able to benefit from that. And then transit may be able to keep some people living within this small town, within your community. And if more people are living there, it might even attract some people to live in that community. So if more people are living there, more people are spending money within the local economy, and there's the economic impacts from that. So you can see, so we developed a method to measure these different benefits and impacts, and you see the ones in green are the ones that we were able to put a dollar value on. The ones in blue, we couldn't put a dollar value on. We just tried to measure them some other way. And there was a couple that we didn't actually weren't able to measure in the study. So when we developed this method, we applied it to a series of case studies within the state of Minnesota. The map on the left shows all of the transit agencies in greater Minnesota, and we grouped them into 6 different groups. And then within each group, we selected one case study, one transit agency to be a case study. So those included Paul Bunyan Transit, which is a large rural system; Timber Trails, a small single county system; St. Cloud Metro Bus, an urban system; Timber Trails, which is a multi-county system close to the Twin Cities; St. Peter Transit, which is a small system serving a single city, smaller city; and then Southern Minnesota Area Rural Transit, or SMART, which is a multi-county regional system. And for each of these case studies, we did surveys of riders. We did onboard rider surveys, and we used the data from those surveys to help estimate some of these benefits. So look at some of the interesting results we saw from these surveys. One question that we asked them is how you would have made that trip that you were currently on if transit was not available. And this really helps us tell us, how valuable is this service? What would they have done if it wasn't available? And across the board, about a third of them said that they would not have made that trip. So that's work trips, healthcare trips, shopping trips that just would not have been made. A lot of the rest would have gotten a ride from someone, from family member or friend or someone else. A few would have taken a taxi or Uber or Lyft if available. Some would have walked. Very few would have driven themselves. Almost none of them, because a lot of them could not drive or did not have access to a vehicle. A lot of them use transit to get to work, and we asked them, how important is it for you to getting to work? And a lot of them, 63%, said that it's very important. They would not be able to keep their job if this transit service was not available. We also asked them, if it was not available, would you need to move somewhere else? And close to a quarter said that they would move, and including about 10% who said they would move to a different town or city. So it's a minority of the riders, but still it's not insignificant. So these are those estimated benefits that we estimated for those 6 case studies for the mobility and efficiency benefits. And what really stands out is this access to healthcare benefit is a really large share of the total benefits. And this is providing trips to healthcare for people who would have missed those trips. And the value of that is if they miss a trip, then it could result in more expensive healthcare trips later on. So there's healthcare cost savings, and it also really improves their quality of life, but by not missing those trips. And we used a method to put a dollar value on that, and so you can see that it's really significant. There's also some public assistance cost savings. The vehicle operating cost savings are basically zero because most of them would not have driven themselves anyway. But there is some chauffeuring cost savings from people who would have had to provide the ride, including the value of the time for them to do that. And then the travel time, the safety benefits, environmental benefits are basically negligible, in some cases zero or negative, but pretty small. So these are the total benefits over the course of the year that we measured for those 6 case studies. And then if you divide that by the number of trips that they provided within the year, you can see the benefits per trip. And we compared that to their total costs per trip to calculate the benefit to cost ratio. And you can see the ratios then range from 1.5 up to 4.2. So for every dollar that was spent on transit, it provided $1.50 to $4.20 in benefits. And that's just those benefits that we were able to measure in dollar terms, but there's a lot of other intangible benefits that are hard to quantify or monetize, and including some of what's on this slide. So most of the riders that we surveyed agreed or strongly agreed that transit allows them to make more trips. It increases their social interaction and therefore reduces social isolation. They say it reduces their stress level, allows them to live independently, improves overall quality of life, and keeps them connected to their town. So these are also very important. That's not really included in that benefit cost analysis, and they have mental health implications, for example. So these are also important to take into consideration. And then another benefit that we did not measure in dollar terms is the transit promotes equity. So we see that transit serves a disproportionately higher percentage of minorities, people without access to a vehicle, low-income individuals, people with a disability, and older adults. And you can really see that in these figures. It shows the percentage of the riders in each of those 6 case studies that were belonged to some of those different groups in comparison to the service area population. So some of them really stand out, the number of riders that don't have a vehicle or are low income or have a disability. And so if the service was not available, they would be disproportionately impacted, and they're not as well served by other transportation options. As far as the economic impacts, we looked at for those case studies, the job supported, labor income, value added, and total output. And this kind of sums up for rural transit across Greater Minnesota and the urban systems across Greater Minnesota. So we see that either directly or indirectly, the rural systems support over 1,900 jobs, and the urban systems close to 1,200. And you can see the amount of labor income that includes and the value added to the economy. And then also the impacts of shopping trips made by transit riders in Greater Minnesota. So we try to estimate, how much money is spent by transit riders on their shopping trips, and what's the economic impacts of that. So this is kind of an estimate across Greater Minnesota. Now, some of this shopping would still occur if the transit was not available, and it's kind of hard to estimate exactly how much of this would be lost. We tried to estimate how much of this shopping would be lost to online shopping if transit was not available in the community, and we estimated somewhere like around 15% of this might be lost to online shopping. And then lastly, we see that transit allows some people to live in the community. If the service wasn't there, they may move somewhere else. And so we estimated what's the economic impacts of keeping those people living in the community. And you can see, like for St. Cloud, for example, by keeping those people in the community, that supports an addition, it's 93 jobs and over $3 million in labor income within that metro area. And then in the rural areas, obviously the impacts are smaller, but there's some economic impact. So in the Minnesota study, we looked at what the benefits are of the existing services that are being provided. And other questions could be, Could there be additional benefits from additional investments, and how much? Where is there a need for additional investments, and what are those investment needs? And those are some of the questions that we looked at in this North Dakota study. So this shows the tasks of the project, and I'm not going to have time to go in a lot of detail for all of these, so I'll kind of give a quick summary. But one thing we did is we looked at the state demographic profile. So we looked at demographics across the state and population growth trends. And we see that, in the urban areas and the oil region, there's been some significant population growth over the last decade or so. But then in some of the other rural areas, there's been stagnant or declining population. But those rural areas also have a high percentage of older adults and people with disabilities, and there's some areas that have higher concentrations of poverty. And so those are areas that would have, the demographics that indicate a need for transit services. So we looked at those demographics as well as population trends across the state, and developed the mobility needs index, which just shows the areas of the state that would have the greatest needs for mobility services. Then we looked at the existing levels of transit across the state, described the demographics of the transit users. We did a state of good repair analysis, which was a model that predicts when vehicles are going to need to be replaced and what the replacement costs will be. Looked at other passenger transportation services that are available in North Dakota. We established some mobility goals and looked at where there's gaps in services. What's the funding needs to fill those gaps to meet those goals. Looked at funding strategies and provided some recommendations. So let me talk a little bit about the existing transit services in the state. This is a map of the rural service levels across North Dakota. So the maps show trips per capita, vehicle revenue miles per capita, vehicle revenue hours per capita. And again, this is just the rural services. It doesn't include the urban services in Fargo, Bismarck, or Grand Forks. And it's the per capita estimates don't include the populations of those urban areas in these estimates. And the regions are based on the existing transit service areas. And you can see, looking at these maps, kind of some similarities between the maps. We can see the areas that have the higher levels of services, such as the South Central area, and areas that tend to have the lower levels of services, such as along the Red River Valley or the Northwest region. And we also looked at, we surveyed all the transit agencies across the state to gather some additional data on their services. We asked them to identify their service area, where they provide service, and then also how many days per week and how many hours per day do you provide service within those areas. And so this shows days of service per week across the state, and it's by zip code level. So we asked the transit agencies, to identify within each zip code what their service levels are. Now, it's not a perfect map because service areas don't exactly follow zip code boundaries necessarily, and more likely to follow county lines or city lines. So it's not a perfect map, but it kind of gives you a general idea of what the service levels are across the state. And so you can see, like in the larger cities, the urban areas, they provide 5, 6, 7 days per week. Across the rural parts of the state, there's a lot of areas that have 5 days a week. But there's also a lot of areas, if you look at the orange and brown, where it's just 1 day per week or even less than weekly. And then as far as how many hours per day that service is available, when it is available, again, in the urban areas, larger towns and cities, it's at least 12 or 16 hours per day. A lot of the rural parts of the state, there's less than 5 hours or 5 to 9 hours per day. So if there's fewer hours of service per day, then fewer types of trips are going to be able to be served by that. People who work later or earlier, they're not going to be able to use it, or just different types of trips are not going to be served very well. We surveyed the transit agencies as well as stakeholders across the state to get their input on what they think the need is for new service and how these services are meeting the needs of people across the state. Most of the stakeholders that we surveyed said that there is a need for new service or additional service. and about half of the transit agencies agreed with that. And when we asked particularly what types of service do we need, they tended to agree on which service, what's needed the most, where it's expansion of currently available services, or just many mentioned weekend service, or just additional days of service. So in rural areas where it's just 1 or 2 days of service, we need more days of service. Or in the urban areas where there's 5 or 6 days of service, we need some additional weekend service. Many also talked about the need for longer hours of service, so service later in the evening or earlier in the morning to serve people who work different hours or to serve different types of trips. Many also talked about a need for new intercity services or services, in particularly from smaller communities or rural areas into the larger cities, especially for healthcare trips. We asked them how well the needs of the residents in the state are being met, and you can see that the stakeholders tended to give more negative responses. About close to half of them said that the needs are poorly being met. We also looked at other transportation services available in the state, including taxi, Uber, Lyft. These are available in the larger towns across the state. In the smaller communities, that are not available, but where they are available, they're more expensive than a transit trip, more expensive for the user, and also they often aren't accessible for people with disabilities. So, and of course, transit serves lower income people and many people with disabilities. So these services are not necessarily an option for a lot of transit users. Also looked at intercity bus services across the state. So Jefferson Lines has a couple lines, a couple routes, and some of the rural systems like Souris Basin and Standing Rock provide some intercity services into Bismarck. And then also Amtrak, and there's different veterans transportation programs in the state. So then next we looked at what the goals are, what the goals should be for public transportation in North Dakota, and looked at the service levels across the state to see, are we meeting those goals or not? And if not, how much additional service is needed? What would it cost to provide that additional service? So we established these benchmark service levels to identify where those investment needs are needed. And these benchmarks are for trips per capita, vehicle revenue miles per capita, vehicle revenue hours per capita. And not just per capita, but per we looked at the demographics, so per senior or disabled population or per low income population, because areas that have a higher percentage of those populations are going to have a greater need for transit services. And then we analyzed the rural transit, the urban paratransit, and the urban fixed route systems separately. They have different benchmarks, and the urban fixed route numbers aren't on here, but they also have some benchmarks. And so then we looked at each of the regions across the state to see if they're meeting those benchmarks, and then and for the analysis that focused on the miles and hours the service that's being provided. And then so if they weren't meeting those benchmarks, what would it cost to, how much additional services needed, what would it cost to meet those benchmarks? And so this slide just kind of is a summary of what we found, of what the funding needs would be to meet those benchmarks across the state. So it includes additional annual operating funds as well as additional vehicles that would have to be purchased. So initially it would cost over $3 million, about $3.2 million in additional annual rural funding per year, and $2 million in urban, for about $5.2 million overall across the state in annual operating funds. And of course, some of that would be covered by federal, would be a federal share. It would require about $10 million statewide in new vehicles. And then we also looked at over time, if we have a larger fleet size, you're going to have an increase in your annual vehicle replacement costs of about close to $1 million per year. And then we also looked at into the future, into 2030, based on projected population growth, what those funding needs would be. So by 2030, it would be over $14 million in annual operating funds, over $25 million in new vehicle purchases. So then another goal of this study was to look at the demographics of the users, of the transit users across the state. And we also surveyed transit riders in this study, and we actually, many or most of the transit agencies across the state submitted distributed surveys to their riders, and we got, just in the rural transit agencies, we got 750 responses from the transit riders, so not including the urban systems. So from those, 750 responses, we got a lot of good information about who is using transit service in North Dakota. And we can see, for this is just for the rural transit systems, over 58% of the riders said they had income less than $25,000. And we compared this to the rural statewide average of 17%. So you see that 40% of the riders said that they don't have access to a vehicle in their household, compared to just 3% statewide. About half have a disability, compared to 10%. A little less than half or were 65 or older, compared to 16% statewide. There was also a higher percentage of minorities. And then for the urban areas, we kind of see some similar demographics regarding income, disability, access to vehicle. It's a little different regarding the age structure. In the urban areas, they serve a higher percentage of working age adults and college students, in Fargo in particular, as well as Grand Forks. A high percentage of the riders are college students. A little bit more about the riders. They rely on, in both rural and urban areas, they ride multiple days per week. They rely on it as a primary means of transportation. And we asked the same question of them as we did in the Minnesota study, is how would you have made the trip if transit wasn't available? And you see some similar results, a little bit different, but pretty similar. About a quarter to a third that said that they would not have made that trip. Very few would have driven themselves. A lot would have relied on a family member or friend, or used a taxi or Uber if available, or walked. And then we also I used that same method that we developed in the Minnesota study to estimate, statewide for rural transit, what would the benefit cost ratio be? So it's based on that same method from Minnesota, and I estimated a benefit cost ratio for rural transit in North Dakota of 1.5. So again, it's providing more benefits than the cost. And for urban transit, it was a little bit higher than that, just because of lower cost per trip. And again, these are just those benefits that we measured in dollar terms. It doesn't include all those intangible benefits. So, in conclusion, from both studies, we see that providing transit service in those rural and small urban areas provides a lot of benefits and economic impacts, especially for providing trips for healthcare or for work. It serves a large percentage of transportation disadvantaged people who don't have a lot of other options, who would be missing those trips if the service was not available. And the results from those studies can be used to help support further investment in transit that can help inform investment decisions. And we looked at where the gaps of services are and the funding needs in North Dakota. And as I mentioned, it really promotes equity and then serves people who are transportation disadvantaged. So I'm not sure if we have a lot of time for questions, but you can also contact me afterwards. Here's my contact info, and Jill Haugs, Jill is the director of CIRCOM and was also involved in these studies, especially the North Dakota one. And then here's a link to our website where you can find our research reports. Thanks.